Well, hello there. I'm Professor Plum. We're here at the Candlestick Conservatory to talk about multiple sclerosis, or MS for short. Joining us today is young Bobby, who will be helping us out as we talk about this debilitating degenerative disease. It's Billy. MS is considered to be an autoimmune disease. It affects the central nervous system, including the brain, the spinal cord, and the optic nerves. The body's natural defenses against infection and disease begin to attack the body's own systems, believing them to be intruders. In the case of MS, the immune system destroys the myelin sheath, which coats the nerves. But Professor Plum, what is myelin? Well, that's a great question, Johnny. It's Billy. Myelin is a fatty membrane that coats nerve fibers called axons. Axons carry information along our central nervous system, allowing us to see, to move, and to control our bodily functions. Think of myelin as the insulation on this electrical cord. Well, I get it now, Professor Plum. But what causes MS? Well, we don't really know, Eddie. Billy! That's what makes MS such a devastating disease. Though research into MS has been going on for well over a century, our understanding of MS still has a long way to go. However, it is generally believed that MS is a combination of genetic and environmental factors. Theories as to the actual cause of MS include faulty gene receptors in the immune system, infectious agents and toxins, geographical location, and even vitamin D deficiency. But we just don't know for sure. Gee, Professor Plum, that sure sounds scary. Will I get MS? It's highly unlikely, Jerry. Billy! According to the National Multiple Sclerosis Society, about 400,000 Americans suffer from multiple sclerosis. That's roughly 0.13% of the total U.S. population. Women are almost twice as likely than men to develop multiple sclerosis, but men are more likely to exhibit severe disability. Although MS can strike any population, Caucasians of Northern European origin, particularly those of Scottish descent, seem to be more highly susceptible to MS. MS usually manifests itself between the ages of 20 and 50, although it can appear at any age. We once thought MS to be hereditary, but we have discovered that that is not the case. Well, gosh, Professor Plum. So how do you know if you have MS? It's another excellent question, Kenny. Billy! MS is difficult to diagnose because its symptoms mimic those of many other diseases, including Lyme disease, lupus, AIDS, even hypothyroidism, to name a few. The symptoms of MS include, but are not limited to, muscle spasms and weakness, vision impairment, numbness, tingling sensations, fatigue, loss of balance and coordination, pain, and bowel and urinary incontinence. These symptoms can range from mild to severe, and there can be great lengths of time between flare-ups or exacerbations. Some people can go for years without having any symptoms and may not even realize they have MS, while others can exhibit severe disability. Laboratory tests, along with the presenting symptoms, are used to confirm a diagnosis of multiple sclerosis. Tests such as MRIs, cerebrospinal fluid analysis, neurological exams, and other tests that measure nerve impulses are used in conjunction with each other to confirm these diagnoses. Imaging tests look for evidence of scars or plaques on the structures of the central nervous system, inflammation, and damage to the myelin sheath. Golly, Professor Plum, can we fix MS? Well, sadly, the answer is no, Toby. Whatever. MS is incurable, but modern science is hard at work seeking more effective treatments for those who suffer with MS. Drug therapy includes the use of steroids and immunosuppressants and vitamin D infusions. Changes in dietary regimens, even acupuncture, have been cited as effective remedies. One of the best therapies for improving the quality of life for those who suffer from MS is physical therapy, which provides exercises that can stretch and strengthen the muscles. It provides patterns of activities that will improve balance and coordination and facilitate function and safety. Ongoing research in the field of stem cell transplantation is reported to be doing well. Gosh, that's swell, Professor Plum. But if I get MS, will I die? No, Andy. While MS is a devastating disease, it is not a fatal one. Most MS patients will have a normal lifespan and will not become severely disabled. However, it must be noted that the quality of life can be negatively impacted and that the rate of suicide among those who suffer from MS is much higher than the national average. Well, I'd like to help, but I'm just a kid. What can I do? You can volunteer to help those in need by contacting the National Multiple Sclerosis Society at nationalmssociety.org/volunteer. That's nationalmssociety.org/volunteer. I'm going to do that today. Thanks for the swell information, Professor Apple. Plum!